As sound waves travel deeper in the body, the returning echoes weaken. Because fewer echoes return, the quality of the image decreases. The gain control increases the echoes that return to the transducer. This makes the structures in the image clearer and easier to see. We often need to increase gain when scanning heavier patients or patients who are near term. This is a profile view of the fetus. We know the gain is properly set in this image because we can clearly see the head, face, chest, abdomen, spine, placenta, and amniotic fluid. You will learn all about how these structures appear on ultrasound in this course. In this image of a fetus, the overall gain is too low, which makes the image too dark. It is difficult to see the fetal structures. Here, the overall gain is too high, which makes the image too bright. Too much gain can make it hard to see the fetal parts, just like when the gain was too low. Sometimes gain must be adjusted differently at different depths of the body. Time gain compensation helps improve the quality of the smaller details of an image at different gain levels. Locate the time gain compensation controls on your ultrasound machine. By adjusting these knobs, you can more finely control the gain at different levels of the image. In this image, the shallower structures in the near field are too bright, and the deep structures in the far field are poorly seen. If you cannot make out the different tissues in the fetus in the near field, decrease the time gain compensation for these more superficial levels. If you cannot see any structures in the far field, increase the time gain compensation for these deeper levels. This is an image of the adult liver. Sometimes the gain is not correct in a band in the center of the image. The arrow on the left image points to a dark band that is undergained. This can also be corrected with time gain compensation. Notice how the image has improved on the right. The next control is depth. Please locate the depth control on your ultrasound machine. Gain controls the strength of echoes returning to the transducer. Depth controls how deeply you send sound waves into the body. Next, we will show how the depth setting changes the appearance of the image. For best quality, the target of your scan should be in the middle of the image. Notice how the fetus is centered in the image. In this image, the target should be the fetus, but there is too much unwanted information because of the extra depth. We are sending the waves too far into the pelvis. We don't need the image below the fetus. We would rather see the fetus centered in the image. Here, the image does not show enough depth to see the entire fetus. Our waves are not going deep enough into the pelvis. We can only see the top half of the fetus and the placenta. In this image, information is lost because there is not enough depth. Make sure the entire structure you want to examine is included in the image. Please notice the placenta, fetal spine, and fetal stomach in this image. Even though the target is in the center of the image, sometimes it is too small to see well. We can use the zoom controls to increase the size of our target. The zoom controls are usually near the depth controls. Please locate the zoom control on your own ultrasound machine. This is a view of the bottom of a fetal foot. The image on the left shows the foot, but it is too small. The image on the right shows more detail once it has been zoomed. You can even see individual bones in the toes. The last of the 5 key functions is the focus. The focus increases resolution of the target. Resolution is the capability of the sensor to observe or measure the smallest object clearly with distinct boundaries. Another way to say this is that you can see more detail in the image. Please locate the focus on your ultrasound machine. The focus should be adjusted so that it is at the center or near the posterior border of your target area. The circled X on the right shows where the focus is in the ultrasound image. In this image, the focus is targeting the near field where the placenta is. The focus should instead be on the fetus and not the placenta. It should be placed in the mid to far field region where the fetus is located. The focal zone is now in the far field below the fetus. It should be moved up to focus instead on the fetus. You will have a chance to learn and practice setting the focus appropriately in our hands-on sessions. Some patients may ask if ultrasound is harmful to them or to their baby. With millions of OB ultrasound scans worldwide, there is no evidence that ultrasound is harmful. There is an important principle in ultrasound that emphasizes this concern for patient safety. This is known as the ALERA principle, which means as low as reasonably achievable. This means that ultrasound should be used only as appropriate and not more than is medically indicated. The ALERA principle states that we should scan a fetus only when there is a medical reason, and that we limit the ultrasound exposure during those scans. We can limit exposure by decreasing the output of the ultrasound machine and decreasing the time spent scanning. We will review this in the hands-on sessions. Excessive exposure can heat the tissues. In theory, a first trimester fetus would more likely be affected from heat than a second or third trimester fetus. To summarize key points from this lesson, ultrasound images are produced by sound waves reflected from the body and analyzed by the computer. The brightness of the echoes can range from hyperechoic to anechoic. Brightness in between is called isoechoic or hypoechoic. Tissues can be characterized as cystic, solid, or complex. There are 5 major functions on the ultrasound machine to optimize the image: overall gain, time gain compensation, depth, zoom, and focus. Ultrasound is not harmful to the mother or fetus. Always follow the ALERA principle with every scan. Questions for review. Please pause the video now to review these questions and answers. What happens to ultrasound waves when they reach air or bone? The answer is that they are reflected. What does fluid look like on ultrasound? The answer is that it looks black. What are the 3 main types of tissue? The answer is complex, cystic, and solid. What are the 5 important buttons on the ultrasound machine that can help you improve the image? The answer is the gain, time gain compensation, depth, focus, and zoom. What is the ALERA principle? The ALERA principle states that we should scan a fetus only when there is a medical reason, and that we limit the ultrasound exposure during those scans. Thank you for your attention and interest in learning pregnancy ultrasound.